It's because we just don't know what we don't know, right? And so with the flu, for instance, it affects millions of people, and death rates are in the tens of thousands, but it tends to really only end up causing fatality in about 0.1% of the population. With the coronavirus, there have been 92,000 cases reported that we know of. Doesn't mean that there are not more, since in the United States we only had 2 labs testing for it through the CDC up until just last week. And of those, there's only about a 3.5% death rate. So the death rate is higher than the flu, but the number that are actually dying from it are a lot less, or could even be, even less than that, depending on how many have actually been affected. What we don't have is a vaccine like we have with the flu. And that's not to say that the flu vaccine is always 100%, but with coronavirus, we don't have a vaccine, and they're actively working to try to create one for it. The other thing is that it is affecting and hurting and killing not just the elderly like we typically see with the flu. So in those greater than 85, the death rate can be up to 15% with the coronavirus, but it can take the lives of anyone. We haven't seen it in children less than 9, which is usually what we also see with influenza. And so we just don't know enough about it, and we don't have a treatment for it. And I think that's the biggest
Is it
fear.
more contagious?
Yeah, so...
and is it transmitted through the air? Is
Right.
it transmitted through human contact? What is it transmitted
So
through?
just like the flu, it is transmitted through respiratory droplets. So coughing or breathing on someone, even just through contact, close contact. So the key is, washing your hands for at least 20 seconds, before you do come into contact with someone. Some people are using masks, but many of them are not even that protective. You need the N95 masks to really prevent those respiratory droplets from coming through. And if you are having these types of symptoms like fever, shortness of breath, or difficulty breathing, where it is much different than your regular cold, then it's recommended that you quarantine yourself. The incubation period here is a little bit longer. They're thinking at least 14 days, but in a study done in China, it went up to even 24 days. So these self-quarantines of 14 days, it's kind of arbitrary in a way, and people are doubting and questioning them because they've seen it be up to even 24 days. And so once you haven't shown any of the signs, then the thought is that you're probably most likely not going to manifest the disease.
And we're just running out of time, but I just want to clarify one thing. You did mention it is the novel coronavirus, because there's a lot of things going around on social